Welcome to the S4OM S4OE Speaker Spotlight Series. These short conversations are designed to introduce you to the brilliant clinicians, educators, and researchers joining us at the summit, not just for what they teach, but for who they are. Today, I'm joined by Cathy Ryan, and I'm so excited for you to hear their voice and perspective before the event. Welcome, Cath. I'm really glad you're here with us.
Thank you so much, my friend. I am thrilled to be here, and it's just such an honor to be a part of this exciting event.
It's going to be really wonderful, I'm sure. I'd like the folks listening to, before we talk about your session, hear a little bit about you and what first drew you into the field of manual therapy.
Well, had you asked my mom that question, she would have answered that by saying it was all due to her because when I was young, she would get me to knead her bread dough for her because she convinced me that I had really strong hands. Really, she was just looking to get me to do the kneading.
Yeah.
But that's not entirely incorrect. That she's the reason. And my mom was a nurse. Two of her sisters were in nursing, so I think an interest in healthcare was there for me from a really young age. And I was a science kid. I just have always been a bit of a nerd that way, and health sciences were always a particular interest to me. Then as I got older, thinking about my career path, an interest in holistic approaches to well-being in healthcare were kind of at the forefront for me. And I think that was just kind of a natural progression towards massage therapy.
Amazing. So, what keeps you passionate about the work?
Oh my, how much time do we have?
2 minutes, Cath. 2 minutes.
2 minutes. I think my love of learning is really a part of what keeps me passionate in this profession because there's always new things to learn. And for me, because I have such a extraordinary opportunity to in person hang out with massage therapists all over the place, their excitement about the work and the great things that they're doing in their practice just keeps me totally jazzed as well.
That's such an important way to kind of look at the work is through the learning opportunities.
Mm.
So let's talk a little bit about your summit session. Tell us, why do scars tell such an important story in the body?
I think from my perspective, on the very basic sort of presentation level, it lets us know that something did not go well during that individual's healing process after some kind of surgery or trauma. And I mean, and the story itself as well, from my perspective, we need to be careful about not making assumptions because everyone's relationship with scars on their body is so incredibly different. So for one person, a scar could be some kind of badge of honor because they were, I see this sometimes in the athletic world where there's some kind of thing that happened and they flung their body and got this scar and it saved the day. And so it's a story that they can tell, bragging rights kind of thing. And then for another individual, even what looks or appears to be a seemingly innocuous or small scar, for that individual could absolutely be catastrophic because of the events or their experience that are related to how that scar came about.
So, what would you say is the biggest myth about fibrosis?
I think anyone who knows me probably knows that my rant is this stuff is not breakable by manual methods. So I think that whole concept of breaking up scar tissue, I mean, in essence, when we're talking about a problematic mature scar, fibrosis is the physical representation of that. So the concept that we can break this stuff is just not supported by science or by my personal clinical experience. I think the other myth that I challenge on occasion wouldn't have the opportunity to do so, is the notion that fibrosis is a done deal. So, once this is a mature situation, that's it. Just
Mhm.
gotta live with it. So, and I'm speaking in reference to the collagenous tissues that we as manual therapists commonly address in our practice. So I'm not talking about organ, types of fibrosis. So, and so essentially it implies to the person that there's no hope that whatever their situation is going to change. So from my perspective, clinically speaking, what I've seen in my practice, and not just me, but many massage therapists, it doesn't really jive with it's a done deal. And as well, the current science doesn't really support that either. I think one of the things that I commonly say is it's fibrosis, it's not necrosis. So it's not dead tissue, it's altered tissue. It's still living tissue. Therefore, there's still cellular turnover that's happening. We just need to figure out why or what is influencing this tissue to not morph or change into something that's more functional.
It's a good way to look at it. So, last question. How do you help therapists move from fixing to listening?
Oh, wow. Oh, my. That's a really great question. Interestingly, I've never clinically come from a perspective of fixing.
Mm,
So perhaps that perspective is not at the forefront of my radar.
okay.
What is at the forefront of my radar is the incredible value of therapeutic alliance or the therapeutic relationship, and such an integral component in that is listening to what the client or patient is describing as their situation, or what their internal embodied experience is around that situation. I've really found it fascinating over the course of my career that, I've had clients describe what they're feeling inside their body. And whatever word or phrase they use to describe that is a perfect fit with physiologically or pathophysiologically what's actually happening inside there. So, that's always has been, impressed upon me. That doesn't really answer your question about how I would encourage people to deviate away from fixing and towards listening, other than saying that our capacity for good listening skills is such an important component in what we do. What these are doing matters, but this matters just as much. So for me, what the hands are doing and that relationship between therapist and patient is as much a driver as outcomes, as mechanistically anything that might be going on in there.
All right. No, I said one last question, but I have one more. What would you say to clinicians who feel intimidated by this work?
And that is probably one of the number one reasons why I might have people come and take a post-surgical massage therapy and scar tissue course with me, is
Hmm.
because they feel like maybe the education and training that they got as part of their entry to practice wasn't sufficient enough. Even here in Canada, where lolly lolly lolly, 2 years. It's the same thing I hear here in Canada. Even though we have a more substantial, let's say, foundation and entry to practice education and training than some places in the world, I'll still have people come to say to me, I don't feel confident enough, particularly in the
Hmm.
post-surgical stuff. So Nancy Keeney Smith, who I co-authored the scar tissue book with, one of her phrases was, if it's open and oozing, don't touch it, talking about, perhaps an incision that's fairly recent. However, that doesn't mean that we can't do work around an area where there's still a gap that is open, as long as we're adhering to good, hygiene practices with respect to reducing the risk of infection. So I would say, look at the science, look for people out there teaching the stuff that maybe can help support you in having a better solid foundation and understanding when, how, and why our work can be helpful for patients.
Education, education, education,
Yeah,
right? It's the way.
sure it is.
And I appreciate that perspective very much, as you know. Thank you so much for being here and for the work you're bringing to the summit. I'm sure we are going to learn a lot and enjoy your presentation.
Thank you so much for inviting me. I appreciate it. And I'm excited.
All right, to everyone listening, this is just a glimpse of the depth that Cath will bring to this session. We can't wait for you to experience everything she's going to tell you in full. And we'll see you at the summit. Thanks for listening.
If this conversation resonated with you, it's just the beginning. This episode is part of our Healing Summit speaker series leading up to the 2026 Virtual Oncology Massage and Aesthetic Healing Summit, happening on April 26th. Each week, we're sharing conversations with our speakers, offering a deeper look into the work, the perspective, and the heart behind what they'll be teaching. If you're feeling inspired, I invite you to join us live. It's a full day of learning, connection, and collaborative growth in oncology-informed care. You can explore the full summit and save your spot at s4om.org. Until next time, thank you for being a part of this community and for the care you bring into the world.